Okay, we're going to talk about the appendicular skeleton right here. Let me get ready. Unfortunately, I can't do this beforehand. Okay. I just want to go over again the parts of any long bone. So at the ends of the long bones, we have articular cartilage. That is one of our connective tissues. And bone is also connective tissue. Articular cartilage. This is for a smooth joint movement. The ends of the bones, right, are epiphyses. Epiphysis. This is the distal epiphysis, so it's farther away from the shoulder. This would be a humerus. And the proximal epiphysis. The shaft of the bone is called the diaphysis. There's an epiphyseal line. This is where the growth plate has fused. This is spongy bone on the inside of the bone, and compact bone. We call this compact bone, really. I think you'll see that more often in the book. Compact bone. And this is the medullary cavity where your red blood cells and white blood cells. This is like the nursery for them. And of course, surrounding the bone is the peri. Peri means around. Osteum means bone. So this is the periosteum. Okay, beginning with the shoulder girdle. This is part of the shoulder girdle. This is the posterior. This is the anterior. This is your clavicle. This is medial, and this is where it will join with the sternum. Okay, so you have a little joint here. And the lateral end will make it's a fibrous joint to the scapula, and we'll see how that happens. So you'll just need to identify the lateral end from the medial end, and that will be on the test, but don't worry about anterior posterior, it's self-explanatory. And I might ask you if it's a left or a right, and you should be able to tell the difference between these two ends. I'll be sure to pick one that's rather obvious. So if we move on to the scapula, it has a front and a back, yes? So anterior and posterior. This is the anterior side, so this will be lying on your ribs, on your back. Okay? So it's roughly triangular in shape. You can see roughly triangular. Right? So at the very bottom is the inferior angle. And then, of course, there's a superior angle. This particular scapula is a little bit different than most that I've seen, but you'll need to be able to identify any scapula, as again, everyone's anatomy is different. On the medial side is the glenoid fossa. This will articulate with the humerus. These are good test questions. What is the name of the feature on the scapula that articulates with the humerus? And that would be the glenoid fossa. It's called the glenohumeral joint. That's your shoulder joint. So this big thing here is called the subscapular fossa. The reason it's called subscapular is because, remember, anatomists in the early days worked on dogs and cats and other animals, right? So their scapula, is something like this. Sorry. So as they looked down on the dorsal, so they're looking down, and whatever they see dorsal. So here's the top of the scapula. That would be the dorsal side. That would be the other side. Deep to that would be sub. So it's the subscapular. That's how it got its name. It's really the anterior side or the ventral side. So we have these two processes, and students get these confused. It's the coracoid process and the acromion process. And the difference between them, and we'll see it on the next slide, this makes it easier. On the posterior side, or the dorsal side, we have this big spine, and it's very, very, very obvious, okay? And it goes right into the acromial process. So if you can remember that the spine runs into the acromion, then you're going to be fine. This is the coracoid here. The coracoid. From the posterior view, very simple. So the acromial usually is more superior than the coracoid. Okay. Superior to the spine, we call it the supraspinous fossa. Supra means above. They could have called it superior or whatever, but they chose to call it supra. Supraspinous fossa. So there's a fossa in here. It's a depression. And underneath the spine is the infraspinous fossa. Okay, here's your medial border. Here's your lateral border. This is the lateral angle, and again, this is the glenoid cavity. So your humerus will be here. Okay? So we're going to look from medial to lateral. And this is the anterior side. This is the posterior side. Here's a beautiful view of that glenoid fossa where the head of the humerus will articulate. And from this fossa, right, you just take a little trip out and you get to the coracoid process. Whereas the acromion will be superior to it, and it's coming off of the spine. Okay, and here again is that supraspinous fossa up here. This is the infraspinous fossa, and this is the subscapular fossa. If you get your orientation right, you should not have any trouble. So again, acromion, supraspinous fossa, glenoid fossa, and coracoid process. Okay, here we're going to move on to the humerus. This is your upper arm muscle. We call it the brachium. Here's our proximal end. This is going to be articulating with the scapula, with the glenoid process, right? Glenoid cavity. And this is distal. This is your elbow. And this is the elbow side. So on the proximal end, we have this rounded head, right? This is articulating with the glenoid fossa. So this is going to be medial. And this out here is lateral. Again, if you can picture in your head how these bones fit together, then you need to orient yourself. Now we're going to have two grooves for the biceps tendons to travel through. There's one groove here called the this is the anatomical neck here, head, neck, right? This is the anatomical neck. This is called the lesser tubercle here. Sorry. Lesser tubercle. It's hard to see on a two-dimensional picture. This is the greater tubercle, and there's a groove between the tubercles. So the groove between them is called the meaning between, tubercular, tubercles, groove. Intertubercular groove. So those are the features on the medial part. This is the deltoid tuberosity. It's bigger in some people. This is obviously where the deltoid muscle will attach, and any attachment makes a roughened, raised spot on a bone. So at the distal end, and this is anterior, okay? So it looks different from the posterior side. So if this is anterior, then this is the medial side. This is the medial epicondyle. This is the trochlea. So the trochlea is on the medial side, And this is the capitulum. The capitulum is on the lateral side. Capitulum, lateral. You're going to need to associate capitulum with lateral because students regularly mix up the trochlea and the capitulum. Medial epicondyle here. This is actually the lateral epicondyle. You're not responsible for it. Okay, this is a surgical neck, and it's called that obviously because if you need a shoulder replacement, this is where they would cut it and they would replace this end. Here's your anatomical neck and your head. So know the difference between the anatomical neck, which is in general right underneath the head, and the surgical neck, sort of logically, is where you would cut it if you were to replace that for a joint replacement. So this is the posterior side. This is a fossa here. And when you see the ulna, it's going to, when your arm is extended, there's a process on the ulna that will go into this fossa. Here's your medial epicondyle once again. So here's a close-up of the head of the humerus. Again, head, anatomical neck, surgical neck right here, surgical neck, lesser tubercle, greater tubercle, and the intertubercular groove. So moving on down to the radius, and the radius is on the thumb side of your arm. It goes down to your thumb side. So again, we have the head. This is the proximal end. This is the distal end. This is the shaft. This is the styloid process right here. Here's a close-up view. Again, the styloid process is right here. This is the radial notch, and you'll see it better on your actual bone. This is the radial tubercle. This is for muscle attachments. Any raised, thickened area on a bone is for muscle attachment. Remember that. Muscle attachment. And muscles won't be attached close, up here. They're down here to get more leverage. So here's the ulna. This is the anterior view. Now the head is at the distal side. This is the proximal. See proximal? And this is distal. So this leads to the carpal bones, and this leads to the humerus. And the humerus will actually, go something like this. Da-da-da. And that's this olecranon process, if you remember, on the posterior side of the humerus. This olecranon process will go into the olecranon fossa. So this in between, this is going to be, it's a bad view for it, but here's a better view for it. See, trochlear notch. Trochlear notch. This is the coronoid. Oh, another coronoid. These are bad. Coronoid process. It's the lip right here. Coronoid process, radial notch. This is where the head of the radius will articulate. And it basically spins. If you take your hand and pronate it and supinate it, this spins within this groove. And there's a big ligament that will surround this and hold it in place. That typically can get damaged, and then you'll have a luxation of that joint. So here's the shaft, medial, lateral, and head. So a close-up of this proximal end of the ulna. This is the olecranon process. If this is the bone, this is the process. Okay, a process is an extension of a bone. This is the olecranon process. This is the trochlear notch because the trochlea of the humerus fits in here. So trochlear notch, now you know where That helps you to identify the trochlea from the capitulum. This little bump sticking out here is the coronoid process. And then here's your radial notch. If we take a different view of it, sort of an anterior view, again, coronoid process here, radial notch here, and this is a depression. Again, the head of the radius, remember, goes into this, and this is round. Can't really draw, but this is round, a circle. So this will spin. This bone will spin. Trochlear notch and olecranon process. So moving down to the wrist. This is a challenge for most people, myself included. These are the carpal bones. The carpal bones make up your wrist, and they allow for extraordinary movement of your hand. This is what gives us most of our flexibility, opposable thumbs, all that stuff. So the carpals are here. You just have to sit down and learn them. If you go online, there are many ways to learn the names of the carpal bones. So this is an anterior view. You must, when you get a hand, you must know if you're looking at the anterior or the posterior. That's the only way that you're going to tell which bone is where. So if we start on the thumb side, right, the first carpal bone will be the trapezium. And the scaphoid bone is a little bit easier because it's kind of long and maybe crescent shape or something. Right in the middle is the capitate bone. Next to the scaphoid is the lunate, then the triquetral, the pisiform, the hamate, and the trapezoid. The trapezoid is at the base of the second metacarpal bone, and the thumb, of course, is called the pollex. Now, if you'll notice, there's some regularity out here. M equals meta, which means near carpal. So metacarpal bone, and this would be 1, 2, 3, 4, and 5. So you have 5 metacarpal bones start at the thumb. The next one out is a phalange. P equals phalange. By the way, it's the same on the toes. Phalanges. So on the thumb, we have 2 phalanges. This is the proximal phalange, and this is the distal phalange of the pollex, or digit number 1. This one is the proximal phalange of digit 2. This is the middle phalange of digit 2, and this is the distal phalange of digit 2. Proximal, middle, distal, proximal, middle, distal, and proximal, middle, distal. 1, 2, 3, 4, 5. So the phalanges are pretty easy. So that's 3, 6, 9, 12, 13, 14, and then 5 metacarpals. That's 14 bones, and they're the same in the foot. So there are 28 bones you learn really quickly. Here's a little, just a little bit closer view. Trapezium, scaphoid, lunate, trapezoid, capitate, hamate, pisiform, and triquetral. You just have to sit down and study these. This is the posterior side of the hand. You just have to spend some time with these. There's nothing I can really do to help you. So good luck with that. Just a straight memorization. Okay, now we're going to start with the lower limbs. We're going to start with the pelvis. And the pelvis, they want you to know the difference between a male and a female pelvis. So if you see this arch here, you see how it's domed shape? And if we go to the male pelvis, it's more angular in most people. So that's the difference. You see, whoops, sorry. Whoops. What happened? Oops, no, I'm going the wrong way. Here we go. Ba-da, ba-da. Now if you notice the wings up here, see how narrow they are between left and right? And if you go to the female, it's more splayed out. Okay, so the pelvic bones, there are two, which are made of 3 fused bones each. Okay. So that's the left side, here's the right side, and this is composed of 3 bones, and this is composed of 3 bones. And they come together at the sacrum, and we've already gone over the sacrum. That's posteriorly. Anteriorly, we have what's called the pubic symphysis, and this is just a fibrocartilage attachment. And during childbirth, hormones make this very lax and allows this to move apart to allow the fetus to exit. So these big holes right here, called acetabulum, are for the femurs. Right? Femur will come like this. This is the acetabulum. You just have to learn the word acetabulum. This bone right here is the ischium. This bone is the pubis. We'll see this later. Pubis. And this bone up here, the big wing, is the ilium. At the inferior part of the ischium, these are actually your sit bones. Sit bones. You can feel them. Just feel around. You know where your sit bones are. It's called the ischial tuberosity. Then you're going to notice these big holes here. They're called obturator foramen. Up on top of the ilia is the iliac crest. Okay. It's the same on the male. So now we've taken the pubic bone apart, and here are the regions for the 3 different bones. The ilium is this giant portion up here. The pubis is a smaller part anteriorly, so this is anterior. And the ischium is posterior. And the view we're looking at is right lateral, meaning this would be the head of the femur, and it would come towards us and then down. So here again is your ischial tuberosity. This is that obturator foramen. This is the pubic, because it's the pubic bone, pubic crest, ischium bone, ischial tuberosity, ischial spine. Anything that projects out, they'll probably call it a crest or a spine. If you notice, these look very similar. One they call a crest and one they call a spine. Silly. Then there's a notch right here. It's a good landmark to know. This is the greater sciatic notch. Then we have, and these landmarks to just help us with our muscle attachments and veins and arteries and nerves as they run through this area. It just helps to identify the locations of those other structures. So this is the anterior side. So we have a little spine here, if you'll notice, a little spine here, a little spine here, and a little spine here. So since this is anterior and it's superior to this one, we'll call it the anterior superior iliac spine. And this would be the anterior inferior. Inferior. It's A-I-I-S. It's A-I-I-S. My mistake. Posteriorly, since it's posterior, this is a P-I-I-S. P-I-I. Posterior inferior iliac spine, and this is the posterior superior iliac spine. So if you know which bone you're talking about, then you can pretty much figure these other things out. Again, this is the iliac crest up here. This is all the iliac crest. And ala means wing, so it's this entire thing. From the other point of view, see this very roughened area right in here? This is for the attachment to the sacrum. So this is never exposed, and it does have fibrous connective tissue joint, which is slightly movable. When you go to the chiropractor, he can pop that. Again, here's your posterior superior iliac spine. Here's your posterior inferior iliac spine. Here's your anterior superior iliac spine and your anterior inferior iliac spine. The ilium, iliac crest, iliac fossa, the pubis, pubic crest, the obturator foramen, the ischial bone or ischium, ischial spine, lesser ischial notch, greater sciatic notch. Obviously, the sciatic nerve will go through there. The sciatic notch is on the ilium. The lesser sciatic notch, because it's for the sciatic nerve, is on the ischium. So you have to find a way to remember that. So moving on to the femur, everyone knows what the femur is. Here's the head. That will go into the acetabulum. And there's a little attachment point there for a ligament. Here's the neck. And then your surgical neck, right, would be here. This is the greater trochanter here. This is the lesser trochanter here. And this is the intertrochanteric crest. There's a raised line right here called the linea aspera or aspera. This is, and the head is always on the medial side, so this is the medial condyle and the lateral condyle, and then the intercondylar notch is between them. Okay? This is the posterior view. The anterior view, now this is medial, and this is lateral. Always orient yourself. This is proximal, whoops, sorry. Proximal, this is distal. So if this is distal, which joint will be right here? Give you 3 seconds. 1, 2, right, knee. Okay, the head, the neck, the lesser trochanter, the greater trochanter, the shaft. This is the patellar surface. Your patella will ride up and down along this area. Medial condyle, lateral condyle. Same things. This is the posterior side, sorry. Lesser trochanter, greater trochanter, and it's this entire thing here. That's why it's greater. Intertrochanteric line or crest. And this irregular surface here, because this is for a ligamentous attachment to the inside of the acetabulum so your leg doesn't fall off, called the fovea capitis. Then there will be a tuberosity here. You can't see it because the lighting isn't great. And this is obviously for muscle attachment for the gluteal, for the gluteus maximus. So on the distal end of the femur, we have the medial condyle, the patellar surface, and the lateral condyle. Again, that's posterior side. Moving on to the patella, I just want you to be able to identify a patella. And they think this is, generally a triangle, so this is the apex, and they don't even call that a base. I might ask you the proximal side and the distal side. The distal side has the little point. Now, if we look at the posterior side of the patella, there are facets Sometimes you get a patella where you can see that, sometimes you can't. I'm not going to ask you for that. So here's your tibia. That's the larger bone in your lower leg. It's the one on the medial side. When you run your hand down your leg, this is the pointy part. You know, it feels real sharp. That's the anterior crest. Okay. This is lateral, right? This is medial. So lateral condyle, medial condyle. Tibial tuberosity. This is for muscle attachment of the quads. This is the medial malleolus. So if you, what you think of as your ankle, the bone that sticks out like on the inside and the outside of your ankle, this is the inside one. Medial malleolus. Medial malleolus. Okay, if we look more carefully at the proximal tibia, here's your tibial tuberosity again. This will vary in size. If you look at a football player, it'll be enormous. The lateral condyle, the medial condyle, and the intercondylar eminence. Oh, we don't have a view of the top. If you look on top here, it's called the tibial plateau, and it includes all of this surface. It'll help you understand the knee joint. Plateau. Moving on to the fibula, this will attach laterally to the tibia. Remember, it's not fibia, it's fibula. And this will generate your lateral malleolus. That's that bump on the outside of your ankle joint. Head and lateral malleolus is all you'll need to know. So moving on down to the foot, we have your heel bone is the calcaneus. Superior to that articulates with your tibia and fibula is the talus. Anterior to that is the navicular bone. Navicular. And then we have the medial cuneiform. First metatarsal, first proximal phalange, and distal phalange. This is a medial view. There's a superior view, again calcaneus, talus, navicular. Now lateral to that is cuboid. And then we have the medial, intermediate, and lateral cuneiforms. These would be analogous to the carpals in your hand. So these are the tarsals. These are tarsals. And again, as with the hand, metatarsals now, not carpals, tarsals, and your phalanges. A little closer view, and you'll need to know that. Okay.